Okay, good evening everyone, and thank you Anthony for the introduction. When I accepted the invitation, I didn't know I was going to be the 5th anniversary guest speaker, so it's really a true honor, and I thank you for that. So glaucoma. What is glaucoma? As Anthony said, I graduated from vet school approximately 25 years ago, and back then glaucoma used to be a very simple disease. Pressure goes up, you have glaucoma. Pressure goes down, you are cured from glaucoma. However, as I tell my students, glaucoma is one disease that the more we learn about it, the less we understand it. And over the years, as our understanding of this disease has increased, we've come to realize that really glaucoma is a multifactorial disease. And there are numerous risk factors involved in the pathogenesis of glaucomatous damage. There is blood flow to the eye, and the immune system is involved, and glial cells are involved, and lots of factors. You can see that elevated intraocular pressure is also one of these factors, but numerous other factors contribute to the pathogenesis of glaucoma, which may be the reason why it's so difficult to treat glaucoma and why so many patients, both in veterinary medicine and in human medicine, go blind from the disease. And in fact, in human medicine, there is a condition known as normotensive glaucoma, where patients have glaucoma, they have all the hallmarks of glaucoma, but they have no elevated intraocular pressure. They are suffering from glaucoma because of all these other factors, but their pressure is normal, and therefore they have what's called normotensive glaucoma, which may occur in up to 40% of human patients. But still, for most people, elevated intraocular pressure is a main risk factor, and I think that it's safe to say that in veterinary medicine, it's the leading risk factor. And basically, when we think of glaucoma as veterinarians, we are talking about elevation in intraocular pressure that is incompatible with normal function of the eye. And as you can see here, we are talking usually about pressure above the mid-20s. So just to remind us where intraocular pressure comes from, aqueous humor is produced in the ciliary processes, part of the ciliary body back here. It leaks into the posterior chamber of the eye, passes through the pupil, and then it circulates around the interior chamber, performing its physiological role. The role of the aqueous humor is to provide metabolic support both for the lens and for the cornea, since these two organs have no blood vessels. And then eventually it drains, it drains out of the eye through the iridocorneal angle and is filtered through the trabecular meshwork and makes its way into venous circulation. What I've just described is what's called the conventional outflow, again through the iridocorneal angle, but there is also what's called the unconventional outflow of aqueous humor from the eye, whereby it diffuses back through the uvea, through the iris, through the sclera, and out of the eye. And as you can see, this unconventional pathway differs in its significance in the different species. It's negligible in humans, but it is quite significant in horses, which may be why we see so little glaucoma in horses, maybe because they have this additional safety valve and they can drain large amounts of aqueous humor through their unconventional outflow pathways. So, to recap, we have constant production of aqueous here in the ciliary body. We've got constant drainage, and the balance, or the equilibrium, I should say, between production and drainage is intraocular pressure. So when we say that intraocular pressure goes up in glaucoma, theoretically it can go up because there is too much production, or because there is too little drainage. But that's in theory. In practice, all glaucoma cases result from impaired outflow, impaired drainage. There are no cases of glaucoma due to increased production, and this is demonstrated in these three cartoons here. You can see that the faucet filling the sink does so at a constant rate. Production is always constant. The problem is always with the drainage. The drain pipe may be too small, such as shown here. It may be clogged up with debris, or it may be blocked as you are seeing here, but in all cases pressure would go up. Production is always constant. We tend to classify glaucoma in two ways. The first way to classify glaucoma is according to cause. And based on cause, we classify glaucoma either as a primary disease, which is a genetic disease. And over here, table on your right, shows a huge study performed by my mentor mentioned earlier, Kirk Gillette at the University of Florida. As you can see, he studied the incidence of glaucoma in over 250,000 dogs. So really a very large retrospective study. And he saw that overall the prevalence of the disease is 0.9% in the population. In mixed breed, as you can see, it's approximately 0.8%. So any breed that has a prevalence higher than this baseline of 0.8% is suspected of having hereditary glaucoma. Definitely when we get into breeds like the American Cocker Spaniel with 5.5, the Basset with 5.4, the Chow, the Shar-Pei, the Boston Terriers, all of these breeds definitely have hereditary glaucoma, and we'll get back to this later. So if we have primary glaucoma, obviously we have secondary glaucoma where the disease is secondary to another intraocular disease, and we'll discuss these in a few minutes. Now, it's important to note that this classification into primary or secondary glaucoma is not just an academic or a semantic classification. It does have clinical significance, because if you diagnose a patient with primary glaucoma, meaning hereditary glaucoma, that patient is probably looking at lifelong therapy because we're not curing the disease. And most important, the other eye is at risk, and this is something we'll come back to again and again. If the patient has secondary glaucoma, then the disease may be cured if we solve the primary problem, and we know that the second eye is not at risk because there is no intraocular disease in the second eye. The other way of classifying glaucoma is according to the state of the iridocorneal angle, which I mentioned draining the aqueous humor from the eye. And based on the state of the angle, we have open angle glaucoma, whereby the obstruction is deep in the meshwork, which is what we're seeing here. Here up on top we have the cornea. Here below we have the iris. So what we're seeing here is the angle between the cornea and the iris, the iridocorneal angle, supported by pectinate ligaments that you're seeing here. Here is the meshwork which filters out the aqueous humor as it exits the eye. And you can see that this is a nice widely open angle, and in cases of open angle glaucoma, the obstruction would be due to changes here in the meshwork. And then again, we have cases of narrow angle glaucoma, and you can see the significant narrowing of the angle here. You see how the distance between the cornea up here and the iris down here has decreased, or even closed angle glaucoma, where the angle has been obliterated due to adhesion between the iris and the cornea. And once again, this division into open angle, narrow angle, or closed angle is not academic or semantic. It's a very important classification and division because it helps us in deciding what drug we're going to choose. For example, if we see that a patient is suffering from open angle glaucoma, then there is no point in treating him with drugs that open the angle because the angle is already open, so we'll be looking at other drugs. And looking at the angle would also tell you whether or not the eye is at risk from for a glaucoma attack, because if you look at the angle, and we will see in a few minutes